Does HRT increase ovarian cancer risk? This was a rather worrying headline suggesting that taking HRT doubled the risk of cancer. This is not correct, but the actual increase in risk on an individual basis is small. Now, hormone replacement therapy, or HRT, uses hormones that are made at laboratory, synthetic hormones, and they're used for the menopause or change of life. The menopause can be very distressful for some women, with hot flushes, night sweats, vaginal dryness, as well as mood changes, with depression or anxiety. Being unable to concentrate can be a frightening experience for women in, say, a demanding position at work. This was a review looking at 52 previous studies, and they did find a higher risk of cancer compared with women who were not taking the drug. The Oxford researchers examined over 21,000 women, and the increase in cancer incidence was directly related to the length of time of HRT use and the shorter length of time since the treatment was stopped. But I think we need to put this into perspective. If you're a woman who has used HRT for a period of 5 years, for approximately 50 years of age, then there is a risk of 1 extra ovarian cancer per 1,000 women and 1 extra death per 1,700 users. This is a very low risk. But if you're listening to this and are worried, then talk to your doctor. The benefits to quality of life have to be weighed against a small increase in risk.